started. I'm Donna Lynn, the CEO of Denver Health. We're thrilled to have Senator Bennet here. I want to introduce our board chair, Patty Lynch, who's on the other side of the senator. And we're thrilled to have you here for many reasons. You have been a longtime friend of Denver Health, and I know you know how important the conversation that's being had in Washington is around Medicaid cuts. And we're thrilled to have some of our patients, some of our providers here to share that with you. I'll introduce our three physicians who are here, Dr. Hanratty, first of all, Dr. Federico, and Dr. Wolf. So the emergency room, a pediatrician, and a provider in government relations, and Dr. Hanratty is also a provider who is head of all of our community-based clinics. So I know you know a lot about Medicaid. But I think what we thought...
Not as much as you do.
Not as much as some of the other people here, too. But we know there are a lot of misconceptions about who is on Medicaid and why they're on Medicaid and what Medicaid provides. So we at Denver Health see over 125,000 Medicaid patients a year. So out of our 280,000 patients, you know, we're in the high 40%, covering close to 50%. They are hardworking, well-deserving people who should be getting health care if only we had a system in America that provided health care for all. So, and in the state of Colorado, 10% of the patients who are on Medicaid come to Denver Health. And I think, as you know, our patients also come from 62 of 64 counties. So we are, despite the name Denver Health, truly a state provider. 2/3 of our funding at Denver Health comes from the federal government, and we received last year about $500 million from the federal government in terms of Medicaid reimbursements. There's been a lot of storms at Denver Health over many, many years, actually 165, long before Medicaid existed. And we certainly have had a serious impact as the end of the public health emergency happened back in May of 2023. So we lost a number of Medicaid members. The state itself lost 400,000 to 500,000 Medicaid eligible patients. And what's unfortunate is that we've seen more uninsured people coming to Denver Health. We've seen some people not taking care of their health in the way that they would have had they had Medicaid. So we all know that anticipated cuts to Medicaid will create both financial hardships, but it'll impact people's ability to work and take care of themselves and their families. So I'm gonna, before I turn it over to the Senator, we're gonna introduce our patients, and I think I'll start with Veronica.
Hi,
Hi.
Veronica Montoya, I'm a patient, and I'm also on the Denver Community Health Services Board of Directors.
And we're gonna let you...
Oh, okay. Well, good morning,
Good
Senator
morning.
Bennet,
Good
and
morning.
thank you for meeting with us today.
Thank you for being here.
I'm your constituent from Denver's North Side, where I live and care for my 90-year-old mother, and rather than take care of each other. I come before you humbled by the medical challenges I've faced over the last 25 years, grateful for the healthcare services I have received from my community health center, La Casa Quig Newton, and Denver Health. A little about me. Prior to first getting sick, I was an up-and-coming Denver real estate broker in both residential and commercial real estate. At the height of my career, I relocated a mid-sized company to Denver. I was featured in an article in the Denver Post called The New Faces of Philanthropy, and received an honorable mention in 5280's Forbes #20. Not long after, I was hit with life-changing health issues, which began my journey on the mysterious path of autoimmune disease that took 10 years to formally diagnose. Excuse me. Navigating these challenges and trying to survive in the real estate crash of 2008 was extremely difficult for me. It was the beginning of the end of my career. I fought hard to manage my career and my health, but eventually my health challenges took over my whole life, and I found it difficult to pay my premiums, co-pays, and deductibles. Trying to work to make money to pay for these things only made me sicker. Eventually, I threw my arms up and applied for Medicaid, food stamps, and am now trying to get approved for SSDI. At the time, I felt like such a failure, but fast forward to now, I know that Medicaid saved my life. 340B has afforded me life-changing monthly infusions, which I will have to be on for the rest of my life to keep the disease that attacks my spine from progressing. Unfortunately, I also suffer from diabetes, fibromyalgia, osteoarthritis, and long-haul COVID. I basically live in a pain body. My community health center has been a hub connecting me to a myriad of specialists that range from rheumatology to neurology to dental and, most importantly, mental health services, because with chronic disease comes chronic depression. My primary care doctor manages and oversees all my various health issues efficiently and with a lot of care. Prior to being with Denver Health, I had a lot of ER and urgent care visits. Now, under the care of my community health clinic, I feel like my health is under control and I play an active role with my care team. Telehealth has also played a vital role in managing my care with my primary care doctor and provided me with a lifeline and hope when I thought I was dying from COVID in 2020 before there was vaccine or much was known. While I do rely on public assistance, it is not a one-way street. My parents raised us to volunteer, and I have done so my entire life for healthcare, education, my neighborhood RNO, and I even volunteered for several of your campaigns. I have always sought to give more than I take. Currently, I have the honor of sitting on the board of directors for Denver Community Health Services. It is an honor to be able to give back to the system that has given me my life back. Managing my health in a way that doesn't burden the system too much and accepting that my health will never be 100% is a daily challenge. Although it has taken great effort for me to be here today, I'm not alone. I am here to advocate on behalf of people like me that rely on their community health centers, that rely on Medicaid. Your advocacy for funding means the world to me and others who are at the mercy of taxpayers to care for us. I am an autoimmune disease and chronic pain warrior, and I do not take for granted the system that helps me navigate my daily health challenges and ability to help my mom age in place at home. Thank you.
Thank you. How old is your mom now?
She's 90. Yeah, but we'll manage.
And I didn't set the stage to ask the senator about his expectations, but I suspect that might have met some of them.
Absolutely. Thank you.
Donna, I think we might pivot to Dr. Hanratty since Veronica is a patient in our primary care system.
So Becky Hanratty, the Director of Ambulatory Services at Denver Health. I am a primary care physician. I see patients at the Eastside Clinic in our federally qualified community health center network. I've been at Denver Health for 23 years, and I have seen lots of iterations of attempts to provide additional health care for our patients. From when I first started, we had just our sliding fee scale, and Medicaid was very restricted. And in those times, I would see patients making very difficult decisions. I had a patient who pawned his watch to be able to pay for his blood pressure medications. And with the expansion of Medicaid under the Affordable Care Act, started seeing patients that we never used to see seeking health care. 50-year-old men are the demographic that never comes in for health care, weren't a demographic that was typically covered by Medicaid or other programs. And we actually started seeing patients who were able to treat their conditions where they were much more treatable before they get to see Dr. Wolf in the emergency department. The thing I worry about are redeterminations and things like that that are being proposed because they hit the people who are least able to navigate the system. And I'll just tell you about one of my patients, Miss Irma, who's 86 years old. She has diabetes. She had Medicare and Medicaid, but lost her Medicaid during the public health emergency unwind because she failed to fill out her paperwork. Miss Irma, insulin skyrocketed in cost with losing her Medicaid coverage, and she had no understanding why that occurred. And so she stopped taking her insulin. And those are the difficult real-world situations that happen with administrative burden for accessing healthcare.
Thank you, Becky. I think it's a good example of real-world experience that we have here at Denver Health as a completely integrated health system set up to do things more efficiently through primary care, or in the case of people going on off insurance, less efficiently through the emergency department, right? And we see that here. It's one of our major concerns. Diana, would you like to share your story?
Yes, I do not have a speech. I'm sorry. I'm the most unprepared person ever. Anyways.
I did not have a speech.
Okay, my name is Diana Corona. I am 26 years old. The reason I'm here is because, first of all, Medicaid literally saved my life. Growing up, I went to Denver schools, meaning I had privilege going to Denver clinics and everything. But as I became an adult, I lost the privilege because I didn't have Medicaid. Once, and coming forward to that is that I started, my health started declining because of weight reasons. Age 22, I was almost 300 pounds. And all because of anxiety, depression, and everything. And because I didn't have the funds to ask for help, and I was scared, especially coming from a Latino family. We do not ask for help, even though we should. Once I broke that barrier and I went and applied for Medicaid and I got all the funds I needed, I asked for help. I asked for help because at age 22, I found myself that I didn't want to live in a way anymore. I was in severe depression, severe anxiety. My feet hurt every single time. Every time I would walk, I would have this horrible sciatic pain, and it just kept going forward and forward. When the Denver Health Bariatric Center opened up, they took me in. They literally showed me everything that they had. I got the surgery, and coming forward to now, I lost 130 pounds thanks to them. And of course, thanks to the effort and the way that they taught me, to the nutritionist center, to the bariatric center, to everything. And slowly but little, I also grew a platform over TikTok, and I have talked about how wonderful Denver Health has been to me, how wonderful Medicaid has saved me. And it's never been like, oh, I'm ashamed to have Medicaid. I am proud to have it because I can always say that Medicaid saved my life. And I am privileged because I now see a future. I don't have sciatic pain no more. I don't feel like I was just stuck in my own body. Many people think that overweight does not affect you, but it does affect you because I was close to having diabetes. I was close to having so many other diseases within me. And I am glad to say that I moved forward from that, and today I'm here to say that Medicaid cannot go away because it would be taking so much privileges from people who actually need it. For example, myself, which I still go to the nutrition center, I still have my checkups daily. I'm still doing things to that. I'm still going and I'm still asking for help. And I cannot afford things without Medicaid. I cannot afford living without it. And this is why I am here to just show that Medicaid just helps not just me, not just some of us, it helps all of us, especially within the Denver community, especially for people who are afraid to ask for help, but we are here for it. And I'm just glad because I'm alive, and I asked for help, and I'm okay now. And I'm glad because now I am here. I can say I'm a survivor, and I'm glad I could share my story with you. It has been not just here, but it has not been just an amazing thing right here, but also with the world.
Sure, of course. Could you tell us a little about how it's changed the way you think about your future? How
Yes,
getting a hold
definitely.
of your-
First of all, I didn't feel like I had a future. I didn't see far enough, towards the future. Now I see plans towards my future. Now I take care of my health. Now I wake up every day at 4 in the morning, go to the gym. I look forward to every meal. I look forward to, see myself. I'm looking forward to going back to school. So it's just, Medicaid helped me look forward into the future of just staying stuck in a place where I just couldn't, see a future within me and with like my family. And I get to spend more time like with my family. I get to enjoy places I go to. It's just, it has given me an opportunity in life again. That's how I see my future, because honestly, I'm not gonna lie, I did not see the future at all.
Thank you.
Yeah.
I think, Ariana, can you talk to us a little bit about what the process was like for you guys, or is like year over year when it's time to sign up for Medicaid? Where do you get that assistance? How hard is that? And if that were made even more difficult, what would life be like?
It's so basically when it comes to signing up, it's very hard just because you have to prove, even though you've been in the Denver community and everything, you have to prove so much, like your income restriction. You have to prove where you live. You have to. It's just something very stressful, especially because it's back and forth, back and forth, back and forth. And it's just, I feel like if we lost that privilege, even though it's a little tough situation, it's very hard. I feel like if we didn't have that, it would be very tough on us. I mean, I'd rather go through the struggle of back and forth and calling in and making sure I always have my Medicaid than losing it completely or even getting my funds cut or anything like that.
Can I speak to that?
Please.
So part of the thing that I've experienced has been this crippling just fear of getting kicked off of Medicaid. So I am a commissioned salesperson, and so, my mindset is, try to make a deal and get a commission, but don't make too much because I don't want to get kicked off of Medicaid, and financially it just didn't make sense because of the cost of my medicines and, everything. And so it's like living in limbo, and the amount that they allow you to make is ridiculous. I mean, I'm just going to tell you, I don't know. If I didn't have my family home and my mom to take care of me, I would be homeless, or I'd have to live with someone, or, you know what I mean? Like, it just, my life would not be what it is. I wouldn't be able to take care of my mother.
I think, could I follow, Veronica, I think that's something that people really don't understand well about Medicaid who are not on Medicaid, and that is that if you earn too much money, then you can't be on Medicaid. But then you're in a position where, unless you really earn a lot more money, you can't afford private insurance. Could you talk a little bit about what that looks like? And when you say how ridiculous it is, I think what you're saying is that I don't want to put words in your mouth, but it's hard to live. People barely live on what.
Yeah, I basically just felt like giving up because I'm like, well, I can't make too much money. So I'll just, live on what I can. And in terms of, my mom is on Social Security. She supports us. She pays for our mortgage and for basically everything.
A 90-year-old.
My 90-year-old mother takes care of me. But I take care of her as well. I drive her to her appointments, whatever it was. But it's very stressful to try to navigate a system that is kind of set up to catch you. And in my case, I deal with sometimes very severe brain fog, and I missed deadlines before and got kicked out of, the food stamp program and Medicaid before, and then you have to reapply. And when you're dealing with health issues, to have to deal with, all of that as well, it's very difficult.
One of the reasons why I think, and the doctor talked about redeterminations, one of the reasons people might not know why this issue is coming up is both because of the work requirements discussion, but also because there's a suggestion in this bill now that you might have to get a redetermination every 2 years, or I'm sorry, twice a year to know whether you're eligible, which is, when I read that, I just thought, how could we want to double the misery that people are going to have to go through? You call it, I wrote it down, the back and forth, the back and forth.
The back and forth. Now I don't imagine it doing it twice a year.
Right.
I always say that my brain is the brain of a person. I think a brain it doesn't, like, I forget things. And I couldn't imagine forgetting the deadline and having to do it again and again and again. Medicaid has not just helped me, but has helped my mom. My mom was diabetic. It helped my dad. He was gonna get his foot amputated due to diabetes. One of his toenails got infected. You know how that goes. There were promises you could get. And no, Denver Health was there for him, and they did everything possible, and he's still walking, so he still has everything. So it's just, Medicaid is there, and it's there for the people who look for it, and there for the people who ask for it. And I don't imagine my mom not having her medication. I don't imagine my dad having his medication. I don't imagine myself not being able to ask for help, being able, because we are already people who are afraid to ask for help. I myself, I'm afraid to ask for help. First of all, because there's this thing where, like, you say, oh, if I ask for Medicaid, people are gonna notice. They're gonna say, oh, she doesn't have, and things like that. And that's where she comes in, and she's very correct on that part. It's like, you have to make a certain type of income, which I think is just ridiculous. It's like,
No more
okay, if I pass by
How
1
much,
cent,
Veronica?
It's like 15,800 per year or something like that.
and if you pass by a little bit, okay, you're
It's
disqualified
done,
from it.
yeah.
But it was, even if it's a cent, or even if if you pass by it, it's like, it's ridiculous. Like, I'm sorry if I made $2 more this year,
Right.
and I don't have my Medicaid.
Right.
So it's just, I think that's the part where it's very, very just absurd. Like, that shouldn't even exist, because I think the United States has to be one of the countries where literally their health insurance is not like Medicaid and everything, that we have to, like, go through all the process every single year.
The other thing about the redetermination twice a year is, on our side,
Oh, yeah.
we have to find the money
Exactly.
to be able to do the work, because we have a lot of people who are in our clinics and here at the main campus who work with our patients, and there's nothing in the bill, to my knowledge, that says, and we're going to double the money that we give you to be able to do that work, and we like to outreach to people as well, not just wait for them to come,
Exactly.
because as you said, maybe you forget it, maybe you're busy. So there's another side to that work in terms of bringing people back. And we saw that, as I said, when the public health emergency ended in May of '23, the state of Colorado lost hundreds of thousands of people who were entitled to Medicaid, but maybe the barriers just kept them from coming in.
Yeah, the sad truth is that in Colorado, we've lived this before. So I first got interested in health policy when I was working in the emergency department, and I would see children coming in
Here?
at Denver Health. Yeah, I've been here a long time.
I know. I'm always surprised at how long it's been.
But, would see a child who had been enrolled in Medicaid, whose asthma was controlled while on medications, would show up to refill those medications, and only to find out then that they had fallen off Medicaid. This is the early 2000s, when in Colorado we were much more restrictive. So this is not news, right? This is not brand new. We've seen this before. I think you're exactly right. Every 6 months, people like Veronica and Deanna are going to show up to their appointment, only to find out that they have not been re-enrolled at that point in time, and then asked to wait on their appointment or wait for their medications and be in this endless cycle, as opposed to being efficient on the front end, providing them the stability of coverage so they can go on and be successful in their space. So I want to pivot here. Denise has also been gracious enough to share her story with us, so I'd like to give you the floor and tell us a different perspective, perhaps.
Thank you. My name is Denise Gibson. I'm 58 years old. I've never used assistance, always had a full-time job and had private insurance. But in 2022, my niece was murdered, and it was a DV situation. The stress from that situation, and I had to go to therapy, and just dealing with the mental and the physical from all of that. I retired from Excel Energy after 35 years in 2022 and found myself uninsured. So last year in April, I thought I had bronchitis. So I went to the emergency room, maybe they could give me a breathing treatment, and I was told I was in active heart failure. And so with that, they said, you're not going anywhere, we need to get this under control. Well, I didn't have insurance. I didn't even know how to apply or what to do. I've never gone down that road before. And the doctors at the hospital, they were so helpful, and they told me what I needed to do, and they helped me get enrolled in Medicaid. And it was a godsend, because I wouldn't even be here today if I didn't have Medicaid. So I was told that what I had was broken heart syndrome and partly hereditary. And so over the last year, I've had a defibrillator put in my body. I've been poked, I've been prodded. I just love the staff here, because if I tell them
For poking and prodding?
yes, if I tell them my toe hurts, let's figure out what's going on. I mean, I'm not questioned. They want to figure out what's going on with me. Earlier this month, they sent me over to University Hospital to see if I qualified for a heart transplant. So I got a call 2 weeks ago that after an allergy test, they would put me on the heart transplant list. And if I didn't have Medicaid, I wouldn't be here. I have 2 children. I've never been in the hospital before other than to have my 2 children. I have 4 young grandchildren. I'm very active with them. I enjoy life. I told Dr. Mark here, I want to live. He says, well, I'm going to do whatever I can for you to live. And if it wasn't for Medicaid and getting the medications, I wouldn't be here today.
Denise, how many medications are you on?
8.
And how many doctor's appointments do you have in a month?
Once a month, if something's wrong, or if one of my tests, because I have to give blood and stuff like that, if one of my tests are off, I may see a doctor more.
And how many times have you been into Denver Health?
Twice. So I'm trying to, the best thing for me is to stay healthy. They told me that once I have the allergy test, I will have a heart transplant within 4 to 6 months. Unless I get sick, if I end up back in Denver Health, I would have a heart transplant within 2 weeks. And you look at me, I don't look sick, but they tell me all the time that I'm very sick.
You definitely don't look sick.
Thank you.
Denise, could you talk a little bit, if you don't mind, about the coordination of your physical health care and your mental health care? You
Stress.
mentioned that, and I'm just curious about what that's been like.
Sorry, after the situation with my niece, the stress, PTSD, I couldn't sleep, I couldn't eat. I had lost over 50 pounds. And I did not know that, you hear how stress affects your body. I didn't know stress could affect your body to the extent it could stop your heart from working properly, and slow down your heart. And it was just a matter of doing both, and I couldn't concentrate going to trial stuff and trying to be supportive in that way. I just could consume that situation. I couldn't work, I couldn't eat, I couldn't sleep. Life just kind of took a stop, and just dealing with that. And like I said, in April of last year, I thought I had bronchitis. I got up, my son lives with me, and he's 25. And I got up and it's like, I'm gonna run to the emergency room. This was at 4 o'clock in the morning. Cause I'm thinking I'm gonna have a breathing treatment and I'm gonna be home by 7 and nobody's gonna even know that I went to the emergency room. And just to be told that I was in active heart failure and that I had to make that phone call to my kids. Well, guess what? I'm in the hospital and they're not letting me leave, which I'm glad they didn't let me leave, and I'm glad that they took the time to give me the tests that are needed. And I look around at people all the time. You see on the news people having heart attacks and people not waking up. But I'm still here, and Medicaid is keeping me here. The doctors are keeping me here. And like I said, I can call or send a note, and they're on it. They're calling me back. Well, let's adjust this. Let's do this. In February, I had to have a procedure done, and I had to drink. I had a colonoscopy and drink all this liquid.
I know, that's really funny.
And I was coughing, and I had this bad cough, and I was like, am I allergic to the liquid? What's going on? So I called Mariah Martin, and I was telling her, I think I was allergic because I have this bad cough. And she says, that's a sign that there's a problem going on with your heart. We need to have an echogram, and we need to do this. And sure enough, there was some problems going on because I had drank, I'm on a fluid restriction, and I had drank too much liquid in a short amount of time, and it affected my heart function. And I wouldn't have known that. You know, I'm thinking, oh, that stuff, I must be allergic to it. I don't know why it's making me cough and stuff. So they're on it. If they weren't so attentive and weren't willing to work with me again, I would be dead. I'm alive today because of the staff here at Denver Health and Medicaid.
When in the process did you enroll in Medicaid? How did that look for you the first time?
The hospital enrolled me because in April of last year, I didn't have any insurance, and they were like, we want to help you. So they came and they talked to me, and they, I got a phone call, a couple of phone calls, answered a few questions. People were coming in because I was in the hospital for 4 days, and they were asking me a bunch of questions and having me fill out paperwork. And before the 4 days was over, I was enrolled. Because I'm like, I don't even know what to do. I've never been on assistance for anything. And I can't say that Medicaid is a lot better than private insurance.
It really is.
It's a lot better.
Why do you say that, and why do you, be interested in that?
Just the hoops that they make
Yep,
you
yep,
jump through. And if they deny something, it takes forever to appeal it.
Yeah.
Where Denver Health, I can talk to my doctors, I can talk to the nurse line, there's several support systems that they have in place. So if you don't know what you're doing, you can get to the right people and get what you need quickly.
Yeah, I mean, just the fact that we have a team here between the admin and all of the staff and doctors, mental health being a huge part of this, I think, for all of us, to help navigate all of this has been extremely, extremely helpful.
We're in what we call Pavilion C, which is our mom and baby unit. One thing about Denver Health, half of all the babies born in Denver are born here. But many of the women who come in have never seen a doctor until the moment that they go into labor. And they come into the emergency room where Dr. Wolf and his team are not only delivering a baby, sometimes, as I said, without any prenatal care, but trying to get them on Medicaid as well. I don't know if you want to mention that.
So my name's Stephen Wolf. I'm the chair of emergency medicine. I've been in my position for just over 7 years, and I've been at Bennet Health for over 25. And I've seen the expansion and now the threat and the fear of reduced coverage and the impact. Bottom line up front is reduced services would cripple the safety net system, and in specific, I think, cripple the emergency department. Emergency medicine is often described as having a room with a view. We are in such a unique position to see the successes and failures of the primary care system, of the public health system, and of the acute inpatient system. And when any of those fail, there's this downstream impact that just cripples our work and our ability to serve our community. When we've heard from Veronica and Diana and Denise about the importance of maintenance of preventable diseases and treatment of preventable diseases that the PCD system provides. It is not uncommon that we see people who cannot get access or who are fearful of the financial burden of the healthcare system putting off engaging in the primary care system and then presenting to the emergency department, which is higher resource, is been proven to have increased morbidity and mortality for the patients when they get to that point, and it's higher healthcare costs. The public health system, when initiatives such as those intended to reduce substance use disorder and behavioral health crises are not accessible or cut back, those patients come to the emergency department when they spiral out of control and they require increased resources, put strain on the system, and cost considerably more than the management, preventative management in the community. And lastly, the inpatient setting, when the patients can't move back into the community, post-acute care type settings like subacute care, long-term care, or having home health to help them with that transition. Length of stay goes up in the hospital, and that trickles down to prolonged length of stay in the emergency department, sometimes on the order of days, and that results in increased morbidity and mortality. And so we see this all the time. Just the other day, I was working on the medicine side of our emergency department, and this 50-year-old, I thought it was really kind of intriguing, this 50-year-old gentleman comes in with chest pain and he gets diagnosed with a heart attack. And after the workup and the treatment, it's determined that he basically had a critically high blood pressure, and he was in what was called a hypertensive emergency. Digging further, he found out 6 months prior, he lost his insurance, he lost his access to his PCP, he ran out of his medicines because he didn't have more than 30 days, and subsequently his hypertension spiraled, causing his heart attack. If we see reduced services, that's going to be a story that I could tell every single day, and that would be so challenging, And that brings me to the one of the another element to highlight is the moral injury, specifically for emergency medicine, of working in a system where you have to treat the crisis state. You know the solution. Maybe it's for a patient who had newly diagnosed cancer. You know the solution, and you can't get the patient to the care they need. You have to basically give them resources and hope that they can navigate an incredibly complex, difficult system that you know they're going to get no. And reap like a cuts to that system would be catastrophic.
What's so staggering about this story is that, there's a lot, but one of the things is that this is the richest country in the world. And in no other rich country in the world would an emergency room doctor sit there and have to tell people in a conversation like this, the story that you just told. Because nobody has to endure those kind of outcomes. I'm not talking about you, I'm talking about your patients. Because it is a reflection of the insanity of the system that we have versus the systems in these other places. And we are spending twice as much, as everybody around this table knows, as any other industrialized country in the world. And what it adds up to is a 6-year shorter lifespan in the United States than these other wealthy countries. If you're African American, a 12-year shorter lifespan than in these other wealthy countries. And that's not what the administration is trying to fix. Like, that would be an interesting question if they're trying to say, wow, how could we increase our mortality so it looked like other rich countries? How could we deal with the pharmaceuticals or the drug manufacturers or the insurance companies? And instead what they've done is reached into the threadbare safety net of our healthcare system and said, we're going to cut there, to pay for tax cuts for the wealthiest people in America. It is, and this is why this is so unpopular with the American people in red parts of the state and blue, or red parts of the country and blue parts of the country, because it's insane. And I'm sorry, I'm grateful that you described it the way you did. I think we have a tendency to lose sight of how extraordinarily, how in a sense we've chosen to create a system with the level of irrationality that you just described. And that's what we should be trying to figure out how to fix, rather than doing what these guys are doing.
And Stephen mentioned an important point, which is moral injury.
Yeah, I heard
Remember, everybody remembers when we were banging pots and pans for our providers during COVID, but what they face every day, I mean, I'm always humbled by it, because I think we think the non-clinicians, like, they have some kind of moral fiber that it just makes them be able to take this. And I think it's hard every day to see patients who, don't have insurance, or who, aren't taking care of themselves on the front end, and they've now got to fix that. And it's not like factory work.
Right.
This is emotional. And my hat's off to all of them for the work that they have to do every day.
It is incredible, and that's another piece of this too. We're losing healthcare folks as it is. We're losing doctors, we're losing nurses, we're losing willingness. I'm not sure we'll ever lose people. Maybe I shouldn't say it sitting in Denver Health, but people here are so passionate about the mission of this place for good reason, because there's so few of these kinds of places. But it's on some level it's sort of unfair of us to try to rely on that as a means of trying to make people healthy.
It's not
And
sustainable.
It's utterly not. It isn't. And just what Denise was talking about. I mean, I could chapter and verse in terms of like the mental health components of all of this too, which are only getting more difficult for citizens and for patients.
Some of the talking points around the current bill has been about, we're not cutting Medicaid, they say. We're just going to cross some restrictions for fraud, waste, and abuse. And hopefully what we heard today from our patients was these are everyday Americans who do work, who do contribute to the system, who just want to be healthy and want some stability. Unfortunately, the patient who couldn't join us is the other side of what the Medicaid program does, which is moms and babies.
Yeah.
And so we're going to have a mom, potentially she's upstairs delivering her baby. I don't know, maybe we're going to check afterwards, because that is how that works. So unfortunately, we didn't hear about that, but you're well versed in that space as well from your time as superintendent of the pediatric piece in our school-based program here at Denver Health, where we also do enrollment in Medicaid for families as well. So
well, and there's also, there are other populations too, which are the parents who have kids who have, very substantial long-term medical needs that, they're the people that are most relentless in this whole thing, because they literally, it is life and death for their children. And then at the other end, there are people who have to spend down their entire life savings. They work their whole lives. To your point, this idea that Americans aren't working is just ridiculous. They work their whole life, and then they have to spend down their entire well, just for the privilege of living in a Medicaid-funded long-term care facility someplace, you know, in Colorado, that doesn't make much sense either. And I want you, I don't know if I didn't say I don't want to get in front of it. So it's another reason why this all doesn't make any sense.
I was just gonna say, you know, my infusions supposedly cost $15,000 a month. I mean, why aren't they looking at cutting down prescription costs
Right,
as
yeah.
part of, you know, because that's what makes it stressful. But I will say, I got sick in 2005 and undiagnosed for 10 years. Being on Medicaid was the first time in all of this process that the stress finally went away because I could focus on my health and not have to worry about how I'm gonna pay for
Right.
everything or, you know, worrying about all of that. So, and it's also what affords me the opportunity to volunteer and to give back, and to take care of my mother. So Medicaid is, I think Medicaid for all, but.
Oh, sorry, of course.
There was a time where, because my husband also has Medicaid, and there was a time where I did not pay attention, and I did get the Medicaid. I didn't have Medicaid because I didn't go and do all the paperwork, and I totally forgot. I zoned out. And he got sick. His, I think it's tonsils, I don't know, whatever this in here, it was closing up. He couldn't breathe, he couldn't talk. His face was so swollen. And when we went to the emergency department, it was a clinic here in Denver House. They neglected the help because we didn't have Medicaid. Like, they couldn't take him in. And that kind of completely broke me because I'm like, I'm sorry, I forgot. It's just, I swear it's been like a week. I'm sorry, I will go get the paperwork. I've been having it for this long time. I've been here. Can you please take him in? They completely told me no. Because they had to get the Medicaid in. And I couldn't be upset with the staff at the hospital because it's not their fault. It's just this way the system works. Now, I don't imagine, you know, not having Medicaid at all. I don't imagine not being able to have or being able to do that 2 times a year, like you said. So what we did is we ended up in the emergency center at Denver Health, and they completely took care of him. But I just didn't want to, like, you know, go to an emergency department, maybe where, like, you know, a clinic could have just helped, you know, make the situation better without, you know, going forward to the emergency department without being like a full emergency situation. So that's where I'm saying that Medicaid helps a lot, and it's just like a little like a thing that happened to me, and then since then I'm like I have to put like a week before calendar wise, hey, this is when I have to renew the Medicaid.
Well, thank you. You know, I want to thank the senator for, this was his idea.
Oh, it was?
It was your idea.
What a great idea. I'm glad it was your idea.
Oh, it was your idea. But, and we're at an inflection point, and we depend on your advocacy, obviously, in Washington. But I want to give you credit because it isn't just at this inflection point. It's been ever since you've been in the Senate to support, you know, whether it's health care for all, it's the Affordable Care Act, it's other reforms. So you've always been a champion. So we thank you for that and for convening this group, and to our patients who share their stories, which I know isn't always easy. So I appreciate your humility in doing that, to our docs for all the work that you do. So
Well,
turn it over to you.
yeah, I would just say a few words. First of all, thank you for being here. Thank you for sharing your stories. All of you, not just the patients, the doctors as well, but particularly the patients. And as I sat here thinking, you know, first of all, there are about 1.3 million Coloradans that are on Medicaid. We say it's 18% of Colorado's population, but that's about 1.3 million people. Every one of those people has a story like the people that are sitting around this table. And if you heard the stories, what you would hear is the same stories that we heard today about being able finally to take care of yourself, finally able to not worry about your health so much, finally being able to address mental health issues as well, getting better, having a future, being able to support your family or be with your family, or just live with your family. And that was my feeling about, I mean, the reason I've always been interested in this part is because when I was superintendent in Denver, most of the kids were on Medicaid, and their parents were working 2 jobs. This was not an issue of waste, fraud, and abuse. It was an issue of people doing everything they could to try to have have their kids do better and have and just thrive in this world. This conversation, we're in Denver having this conversation. We could have easily had this conversation in the most rural part of Colorado as well. And I have had it over and over again in the most rural part of Colorado, in deep red, political counties where I will never, ever, ever, no matter what I do, get more than 20% of the vote, but where there are medical professionals who are doing everything they can to try to deliver health care for their patients under incredibly adverse circumstances, and their patients, just like the people here, who are just trying to do the right thing for themselves and for their families and their communities. And they very often, what I'll hear people say in these meetings is, if there is waste, fraud, and abuse, we'd like to get rid of that as well, but we don't see it. And the story they are telling is of there being huge parts of Colorado where there is no OB service, where there are people have to come to Denver just to have a baby because there's no place else to do it. As an example, that's before the cuts that are being proposed, and that's why I'm so worried, Donna, about this particular bill, because it's not like things are going so well as it is, and there is a big conversation we could be having, as I said, to make things better, and I'll come to that. But in a second, but that's not the conversation now we're having. We're taking a system that isn't working as well as anybody would wish. Not Medicaid. I'm talking about our healthcare system, and it's going to make it worse. And we all need to care about this. Every single one of us needs to care about it, whether we're on Medicaid or not, if we're part of the healthcare system. Because what will happen if these cuts go into place is that people will become uninsured. They will lose their insurance, which doesn't mean they're going to lose all their health care. It means a lot of their health care will look like the way you described it, doctor, which is getting your health care too late, getting it under emergency conditions like Diana just said about her husband, getting it when it's the most expensive it could possibly be, rather than getting the primary care that is much less expensive and much less and in a much better way of getting your health care. And that is going to raise everybody else's costs. It will raise everybody's costs at the hospitals. It will raise everybody's costs in what they pay for insurance, because that's what happens to so-called uncompensated care, is that it gets shifted over to everybody else. So this is a concern for everybody that I represent in Colorado, whether they're on Medicaid or they're not on Medicaid. And then finally, the system just isn't working well enough for anybody at any level. I all over Colorado, people say to me, we can't find primary care doctors, we can't find primary care nurses, we can't find mental health for our kids. I had a young woman from Western, who's just graduated from Western in Gunnison, last week in my office in DC, and she said, you reminded me of her, Diana, what you said. She said, I'm about to come off my parents' health insurance. I have one more year on their health insurance. She's not on Medicaid, she's on private insurance. But she said, what am I supposed to do to afford health insurance? Am I supposed to work for 2 or 3 jobs to pay for health insurance? And why are we asking people that are in their 20s to have 2 or 3 jobs just for the privilege of having health insurance that is going to hang the phone up on them when they call and say, I've got to, or maybe keep them on the phone for 2 hours to fight about it. We're living in a moment where I'm telling you, I can do it. We could set up a table just like this anywhere in Colorado. I can remember one place in particular, Pueblo, where seniors were saying, our whole lives, these are people that have worked their whole lives too. Our whole lives are spent trying to navigate pharmacies to get the prescriptions filled that our doctors have given us to fill. And I can only afford to get one inhaler filled, and not two, or not three, whatever it is that I've been prescribed. That's how people are spending their retirements in America. That's not how people in other wealthy countries in the world are spending their retirement. So my hope is that these guys will come to their senses. I don't have a high expectation that they will, but I do think that one of the benefits of this debate is that the policy that they're talking about, especially with respect to cutting Medicaid, is so unpopular with the American people because I think they understand that there are big problems with our healthcare system, big problems with our drug companies, big problems with insurance companies, big problems with lots of things, but you know, the people that are on Medicaid is not one of those problems. And it will just make matters worse to have a bunch of people that don't have healthcare coverage. So, you know, thank you for having me. Thank you for being here. It makes it much easier for me to go back and be able to be an advocate because of what you're doing. And I also want to just thank you, Donna, for your extraordinary leadership here. And Madam Chair, yours as well. Because it's not like Denver Health hasn't held up its side of the bargain, you know, and I would say that's true of hospitals from Hugo to Craig, you know, in Colorado, where people are trying to just somehow keep the plate spinning. That's how I think about it sometimes. It's that hard for what people are trying to do, but you think about what Denver Health did to try to go out, you know, last year to raise taxes from the Denver community to support the work that's so important that's here at this safety net hospital. And the last thing we need at this point is for there to be Medicaid cuts. It's going to make it even harder for us to do. So thanks for what you do, and thanks for what you do, and thank you guys for being here today. I am very, very grateful that you were willing to take time. Please know that, you know, there are always people, I always think about people that couldn't come. You know, there was no way they could get here because they were working another job today, or they were taking care of their kid, or picking somebody up from school. And I know you interrupted your life in a major way to be here. Just, I would like to say, if I could, on behalf of all the people that would have been here to talk about their kids, would have been here to talk about their loved ones, how grateful I am that you were here today to have this conversation. And good luck with the heart.
Thank you. Keep up the fight.
Keep up the fight. Thank you, everybody.